we first going to see which factors are also associated with chem morphology, so with the presence of this bony bump on the head-neck junction. If we first look at gender, then we see that it's more frequently present in males than in females. So in the general population, chem morphology is present in females around 0 to 15% and in males 15 to 25%. Genetics might play a role, it's probably a minor role. There are some studies that show an indirect evidence that genetics plays a role. For example, we know that Caucasian people have a higher prevalence of chem morphology than Asian people. And another study showed that siblings of patients with chem type FAI were 3 times more likely to have chem morphology than the patient's spouses. So this also more or less indicates towards a probably minor genetic role. Then the orientation of the growth plate. What has been shown previously is that a growth plate in the femoral neck, which is normally more or less horizontal, but when it bends more towards the femoral neck, that is associated with chem morphology. I will show you some examples of that. But athletic activity, the final one, is probably the most important factor. So we know that the prevalence of chem morphology in high impact athletes can be as high as almost 90%, so almost everybody basically. Whereas in non-athletic controls, the prevalence of chem morphology is only 9%. So athletic activities is probably the most important factor in the development of chem morphology.